Hi, I am Dr. Sharjeel, and today in this video we will discuss one of the most important ocular disease that is encountered in the children. I will show you few cases of infants who are brought to me with complaints of persistent watering, mucopurulent discharge, redness. Some parents complain of small looking eyes as compared to the other eye since birth. Now, age of presentation of such children is very important, and here I am drawing nasolacrimal system from punctum, common upper and lower canaliculus, common canaliculus, lacrimal sac, nasolacrimal duct, up till valve of Hasner. So the age of presentation is very important. If a child less than 1 month old is brought to you with above mentioned complaints, then most likely diagnosis is ophthalmia neonatorum, because normally the tears start to produce around 20 days of age. You can observe this phenomena if you keenly observe the crying of a child less than 1 month old. You will not see cheeks or eyes full of tears. So that discharge is pathogenic. You should suspect congenital nasolacrimal duct obstruction when the child is more than 1 month old and brought to you with complaints of persistent watering for longer duration of time. Because if a child is brought with redness discharge for few days, it can be conjunctivitis. So you should be able to differentiate conjunctivitis from epiphora. Parents say that as soon as we stop instilling the antibiotic drops, the watering starts. So that's also an important history point. So in order to understand the pathology, first comes to the anatomy of the drainage and tears. Nasolacrimal system starts with the upper and lower puncta. So observe the patency of these tiny openings, that is followed by canaliculi who meet at the end to form common canaliculus and open into a vertical nasolacrimal sac. The secretions, the mucopurulent discharge that comes out from the puncta is basically produced by epithelial lining of the lacrimal sac that is unable to pass through NLD due to obstruction at the inferior end of NLD by valve of Hasner. Congenital nasolacrimal duct obstruction is a very common disease. It affects 5% of the newborn infants. Blockage most commonly occur at the valve of Hasner at the distal end of the nasolacrimal duct, where it opens into the inferior meatus. The block can be unilateral or bilateral, and rate of spontaneous resolution is 90% within the first year of life. Most common pathology is the membranous obstruction at the valve of Hasner. General stenosis is the second most common cause of the duct obstruction. Children with Down syndrome, golden heart syndrome, craniosynostosis, or any other midline facial anomaly are at increased risk for congenital nasolacrimal duct. Now here we have told you that antibiotic drops, then lacrimal massage, therapeutic probing, close intubation, and DCR. These are the steps. How you should go for these steps, we will discuss later on. So the differential diagnosis are acute conjunctivitis. So history is important, as persistent epiphora will be for longer duration, whereas conjunctivitis will have acute history of a week or less. Glaucoma will have all the above mentioned symptoms, but boophthαλmos and raised intraocular pressure as well. Then the lid malpositions or dystichiasis can be ruled out with slit lamp examination. Now here, this patient, you can clearly see that the left eye is a small, there is a mucopurulent discharge, and history was of longer duration. So management is observation and topical tobramycin drops for acute exacerbations, followed by gentle lacrimal massage. Kushner reported that the lacrimal massage performed with occlusion of the common canaliculus and firm downward pressure on the lacrimal sacs was more effective than gentle massage. It creates the positive hydrostatic pressure and tend to perforate the membranous obstruction at the valve of Hasler. Topical antibiotics and lacrimal massage is carried on till 6 months of age. Tell the mother to cut the nails, wash the hands, and then perform the lacrimal massage. This is also called hydrostatic lacrimal massage. Now, this maneuver is done by putting the finger firmly at the common canaliculus and then dragging it downwards and medially along the path of the nasolacrimal system. It should be performed as much as possible by mother, but at least 10 times in the morning, 10 times in the afternoon, 10 times in the evening, and 10 times at night, and should continue until the nasolacrimal system opens. If despite massage the epiphora did not resolve till 6 months of age, then I opt to therapeutic probing. Now, some doctors give 9 months time, so you can delay probing till 9 months of age or opt it at 6 months of age. My experience suggests that early probing has got better success rate as compared to delayed probing. Now, this is the wrong way of doing nasolacrimal massage. The movement should be down and medially. Most of the time, the watering resolves after one episode of therapeutic probing, but it can be repeated second time after 3 months of gap. Probing success declines as the age increases, especially after 12 months of age, but you can try it up to 15 to 18 months. If the condition did not resolve, then after 18 to 24 months age, you have the option of close intubation, in which you pass the DCR tube stent along with the probing and tie its ends in the nose. More than 95% of children will be disease free after the above mentioned treatment options. But if NLD block persists even after 3 years of age, then balloon catheter dilation can be done. In this procedure, probing is performed first, followed by the insertion of a lacricath balloon catheter into the duct. Balloon is then inflated and withdrawn. If all the above procedures fail, then the last resort is tracheocystorhinostomy. It has an excellent success rate in children, up to 96%. It should be performed not before 5 to 6 years of age, because the facial bones are growing in this age, and you have to give time to these bones to achieve some strength before breaking it for NLD block. So I hope after watching this video, this extensive talk on congenital nasolacrimal duct block, you will be able to diagnose and treat this condition.